This is your bonus, ladies. So you might be watching this in pregnancy, or you might have had your baby already and will be watching this after your birth. If that's the case, congratulations. I'm here with Rebecca, the osteopath, and we are going to just be talking just for a few minutes about some of the common issues that babies experience after birth. So something that I see when I'm a midwife is sometimes babies that are very fractious, they're unsettled, they are fussy, they really want to be with mum all the time, but then even when they're with mum, they're still not settled. So is that something that you see in your practice?
So yeah, I definitely see that, and the way I interpret it is that the nervous system is on high alert and can't settle.
Sure.
So we've got what's called the autonomic nervous system. It has the rest and digest part of it, and the parasympathetics, and then the fight or flight sympathetics.
Absolutely.
And sometimes babies can still be in that fight or flight mode after birth.
That's interesting.
Yeah, and the more complications there have been in birth, then the more that can happen. And I think what's just really important is to recognise what state that baby's in. So a baby who is like doing a lot of reflexing, startling all the time, can't sleep, needs to be rocked quite vigorously, that's all related to their nervous system, and just recognising that they're in that state, and it's going to take some time for them
to relax.
To relax, exactly. And babies like that don't need overstimulation.
Right.
So just something to watch out for.
So that's a really interesting thing, and I think perhaps that's something that isn't widely known in our culture, definitely. So mums, if you have a baby that's a bit fractious and won't settle, you will be doing things like keeping handling by your friends and family to a minimal, probably.
Yeah. And I know for every mother, sadly, breastfeeding doesn't work out, and so. But for those who are lucky enough that does happen, that's incredibly good for the baby's nervous system, because the hormones you're producing really help to settle.
Very calming. Being next to mum, so skin to skin might be a lovely thing to do.
Equally, yeah.
Baby's in the nappy against mum's skin.
Yeah.
Baby can hear your heartbeat, isn't feeling the rhythm of your breath.
Yeah, you can learn just to breathe slowly and calmly.
That's good.
It's not easy always
No.
when you've got a crying fractious baby.
Or just in life,
Or in life,
generally.
exactly.
That's really, really interesting. The other thing that I sometimes see in babies, and this can be a baby that's born, can be any way, doesn't mean that the birth's been tricky. Sometimes babies just don't latch easily. They take their time, and maybe they're not opening their mouth, maybe when they go on they're not really sucking very well. What could that mean? So
that can be the suckling reflex is a complex reflex. It involves many different parts of the body, many different nerves, so it can be caused by many different things. It's not usually a single thing, but I kind of look at it sometimes from a mechanical perspective, and an important area we consider as osteopaths is the base of the skull and the top of the neck, and there's various nerves coming out of there, including the hypoglossal nerve, which is the nerve for the tongue.
Ah, yes.
And that can get between the two. So the skull is still in separate parts in the baby, and there's just these little bones called the condyles of the occiput. They're in two parts. The hypoglossal nerve is coming from a little hole between those, and if there's a little torsion or twist between that, it can pinch them. So theoretically, we look at that osteopathically.
So interesting.
And there's other nerves, like the facial nerves, that affect the muscles of facial expression. There's the muscles, trigeminal nerves, which affect the jaw muscles. There's a whole load of nerves coming out from that area which can affect the ability to suck,
Yeah.
and you can also get different kind of compressions, and well, the way I look at it is that there's babies can be compressed inside the womb.
Absolutely. So it could be happening before birth.
Before birth, or during the birthing process. That's something that's got a bit compressed or overstretched and out of balance. So it's like pregnancy, about being in balance with babies. Optimal function comes from optimal balance.
And alignment. That's very interesting. So for the mums out there, if they're watching their baby's a bit fractious, or it's not feeding so easily, so we've talked a little bit about being aware, and what else could they do in a practical sense to help support that baby to get back into balance?
You might want to look at, add one thing about a baby's head shape as well. So the head is, this part of the head, the vault, is designed to overlap as it comes out of the womb, but then it should, over the next couple of weeks, expand, and we don't want to continue having an overlap in those joints. And if you're seeing that your baby's head is very bumpy and bony in different places, maybe more on one side than the other, then that's maintaining, then that's a sign that there is some sort of misalignment in your baby's head. And I would personally, as an osteopath, recommend going to get see someone for your baby, because I think it can be really helpful.
Yeah.
Other little things we talked about before, even with we talked about that coccyx maybe kind of getting stuck on the baby's nose there, and you can end up with a baby who's quite congested, or like you get a weepy eye, and if you can just free up there and different areas of the head, it can help.
Get everything moving.
Flowing.
So if you do have a baby with some of those symptoms, ladies, we would really recommend that you go to an experienced osteopath, and that's someone who can help support you and your baby. We hope you enjoyed the programme, and sending everybody out there lots of love from us. I'm going to say bye.
Bye.
Bye.